Good morning. Welcome to our Wellness Wednesday. Thank you for joining us this morning. Our Wellness Wednesday airs the second Wednesday of each month. Bring in focus to a different mental health topic each time. My name is Nicole Moccasin. I am the community health worker for the Ponca Tribe of Nebraska. Joining me today is Dr. LuAnne Even, behavioral health officer and clinical psychologist at the Friendly Roy Health and Wellness Center in Omaha. Thank you for joining us today. And today we'll be speaking on mental health self-care. First question we have, over the past couple of years, it appears the term mental health has begun to expand. I begin to hear the word mental health used a lot more in movies, music, and daily life. How would you actually define mental health?
All right, thanks, Nicole. I'm excited to be here today. So talking about mental health is really important. And I think we have seen a lot more conversation surrounding mental health. It's becoming more, mainstream in our media today. If you want to look at an actual definition, it would probably be the one psychological and emotional well-being. And I think that kind of encompasses everything from, good feelings to bad feelings and everything in the middle.
So the second question, for those of us who do not work in mental health fields or with mental health disorders, it can be sometimes difficult to understand those who are diagnosed with disorders. Would you say mental health disorders are common? And as a clinical disorder, what would you work with the most?
So, are mental health disorders common? Absolutely. I think looking at some statistics, 40 million people were affected with an anxiety disorder last year. Over 1 million people managed to work through at least one major depressive episode last year. 1 in every 20 children is diagnosed with either anxiety or depression. And so while it's extremely common, it's not getting treated. So less than 40% of individuals are actually seeking treatment for the depression. And your second question that you asked me was, what do I work with the most? And I think that really varies on kind of population. I've got a couple different practices here. I see so much anxiety, depression, work a lot with trauma. We also see a lot of bipolar disorders and substance use disorders. So the diagnoses can really vary.
Okay. So over the previous years, many of our friends and family members have suffered through the pandemic and have begun experiencing anxiety, depression, loneliness, and other concerns. What do we do if we believe family members, friends, or someone else we know is suffering from a mental health illness?
So for this, I'm going to use kind of a catchphrase from the American Foundation of Suicide Prevention, and that's just have a conversation with them. To be able just to ask them, how are you doing? To reach out and check in. That is the most important thing to do for somebody that you think might be suffering from some kind of a mental illness. They probably won't necessarily reach out to you. So having a phone call, sending a text message, sending a Facebook message, something just to check in and start that conversation is crucial.
So I've noticed that mental health has become more talked about in society, and it appears that there is more help for people diagnosed with mental health disorders. Do you believe that there is a stigma surrounding mental health conditions?
I think the stigma has definitely reduced in recent years. We see a lot of, especially our younger generations, really talking about their mental health, their anxiety, their depression, whatever they're being troubled with at that time. But I do think there's still a stigma, especially in our adults and older populations. There's still a stigma about coming out in workplace. There's still a lot of fields where mental health is not allowed to be talked about because it is thought to believe to impact the job. So while I think it's getting better, I still think there's a lot of work to be done.
Another word I hear people bring it up when discussing mental health is the term self-care. Can you define what self-care is?
Yeah, so this is totally a buzzword right now, but if you look at the Webster Dictionary definition of it, it's basically taking an active role when discussing one's mental health, in particular during periods of stress. So taking an active role in your own well-being, both emotionally and psychologically.
I have noticed that self-care has become a very used term in society, and so many people talk about the importance of self-care. Is self-care actually as important as people say?
So yes, sorry, as depression and anxiety are increasing, self-care is becoming ever more important. It is important to take care of yourself to reduce things such as burnout, irritability, anger, anxiety, depression. So it is as much important as we are hearing in the media, if not more.
Thank you for defining self-care to us and telling us about the importance of it. I was wondering, what are some of the best ways to practice self-care?
So this is very individual. Some of the things that a lot of people talk about is, taking a time out, taking a bath, going for a walk, reading a book. There are so many things that you can do, but it really is individual of what works best for you. So it's really nice to have a lot of tools in your toolbox. So if you're somebody who's chronically overwhelmed or stressed, going for a walk or taking a long hot shower might work best for you. For other people, it might be taking a time out and watching a Netflix episode or doing some journaling. So I would work on finding a lot of different things that can help you create that time out for yourself and then finding out which one works best for you. For me, it is always, going to the nail salon to get my nails done on a Friday afternoon and then, maybe going for a long run on a Sunday.
Okay, well, thank you for joining us for Wellness Wednesday with Dr. Even. Join us August when our next topic is bullying and friendship.